So I mentioned the PPE optimization, because of this critical shortage of PPE that we've been experiencing throughout this pandemic, the interim guidances were developed, and they include that available respirators should be prioritized for procedures that are likely to generate respiratory aerosols, which would pose the highest exposure risk to healthcare personnel. And to remember that a face mask does protect the wearer from splashes and sprays. So if you're not using aerosol generating procedures, you may be able to wear a face mask with a face shield instead. Respirators, of course, filter inspired air, and so therefore offer the higher level respiratory protection that you'd need for aerosol producing procedures. In hospital settings, they talk about sputum induction and opening suctioning of airways. So you can kind of see from that the respiratory aerosols they're talking about contain almost exclusively respiratory secretions or sputum, whereas in dentistry, it's saliva that may contain some respiratory secretions and therefore virus if you're treating a person who is indeed infected. The CDC guidance on optimization of PPE cautions that we should not extend the use or reuse disposable PPE until we've done everything else that we possibly can to prevent ourselves from not having to do that. And some of the work practice and administrative controls that they mention in their guidance is that you do this when you're providing only urgent care, that you would not take the risk of reusing disposable PPE if you're doing routine procedures, that you limit the number of people in the facility so that there's less risk of exposure and there's fewer people that need the PPE, that you provide telemedicine or teledentistry, that you limit your procedures in the length and in the spread of oral fluids so that again you can reduce the risk of exposure. And if you want to look at the guidelines, there are strategies to optimize the supply of PPE and equipment. It is available online, and there's a full list of the administrative controls that they are suggesting. So what is the optimization of PPE? What kind of strategies are they talking about? Well, they're talking about things like wearing a surgical mask for more than one patient encounter. So that would be, extended use. You put a mask on and maybe you're doing very quick procedures. The mask doesn't get wet or contaminated. And so you continue to wear that same mask for more than one patient. Same thing for respirators. As long as they maintain their fit and function, that you might practice an extended use where you put it on and you just leave it on and not take it off. And when you're using PPE optimization strategies, the training on the PPE use, including proper donning and doffing procedures, which may be different, and I'll talk about that in just a moment, have to be provided to healthcare personnel before they start carrying out these patient care activities. And of course, this is not for when adequate supplies are available and not for routine procedures, but when there's an emergency critical needs situation, such as we've seen, over these past couple of months. So extended use is one thing, reuse is another. Of course, reuse carries a higher risk because you're dealing with a potentially contaminated piece of PPE that now you're going to handle again. So the recommendations from NIOSH are that you discard the N95 respirator if you've used it during aerosol generating procedures because it's going to be contaminated. And that you also discard it if it has become contaminated with blood or other body fluids from the patient. Always consider using a cleanable face shield, which is preferred over goggles, because it helps protect the N95 respirator and it reduces the surface contamination. So you can maybe use it a little bit more safely if it hasn't been exposed to as much spatter and spray. If you're going to reuse the respirator, they make a couple of suggestions. One would be that you hang the used respirator in a designated storage area. So you set aside a place and you put a hook on it, on the wall, and that's where you put your respirator. Or you could put them in a clean, breathable container like a paper bag between uses. And then also to ensure that you don't cross-contaminate respirators, if there's more than one people using one, that you store them so they don't touch each other. And the person who's using each respirator should clearly be identified. So you don't want to write on the respirator itself. You should never put any markings or stickers or anything like that on the surface of the respirator, but you could put your name on the bag or the storage container that you're putting it in, or you could put names over the hooks where you're hanging it so that you don't accidentally use somebody else's respirator. Also, if you're going to reuse the respirator, you would clean your hands with soap and water or an alcohol-based hand sanitizer, both before and after touching or adjusting the respirator, because sometimes you need to do that to maintain the fit, or because it's become uncomfortable, you need to shift it around a little bit. Avoid touching the inside of the respirator. If you do inadvertently touch it, then touch the inside, then you need to discard of it and then perform hand hygiene, because you don't want to have contaminated the inside of your respirator and then put that right up against the mucous membranes of your nose and mouth. That's certainly introducing a risk. And then when you're donning a used N95 respirator, use a pair of clean gloves. And then, because when you do the seal check, you have to put your hand over the respirator and hold it against your face and blow out to see if any air escapes. And so you'd want to wear a glove to do that if the respirator may be contaminated. And then you don't want to use that same glove in treating the patient. So you'd need to discard that glove, perform hand hygiene, put on new gloves, and then provide care.